Okay.
So we're really excited to sit down and just talk a little bit today about the consequences in this healthcare debate. Sometimes it can become more of a process story about Democrats and Republicans, but this is really about human beings. And as we know, in Virginia, we've missed for 8 straight years the chance for 400,000 of our neighbors to get coverage under Medicaid expansion. We've let $10 billion flow out of the state. But I think underneath the big macro numbers like 400,000 and 10 billion, you forget that this is something that covers addiction services, something that covers mental health coverage, something that has probably the biggest impact, ironically, in some of our poorest rural communities that have sent some of these legislators to Richmond who are denying that here in Virginia. The last thing I just sort of wanted to say off the top is, you know, sometimes we think about this as other people because it's those on Medicaid, but I think a couple things we have to remember. One, there are an enormous number of Virginians who rotate in and out of Medicaid coverage if they fall on tough times or have lost a job. So really a lot of this is about making sure people have that safety net to have the opportunity to come back up. The second is that it has a huge impact on people who already have private insurance. So you may think, well, this doesn't affect me because I have private insurance, but all of our premiums are higher in Virginia because the Republican legislature has refused to expand Medicaid. What happens, of course, is that means we have hundreds of thousands of uninsured who, of course, get sick. They go to the emergency room, and those costs get passed on to all of us with private insurance. So this isn't the Republican Party I grew up with that was very pragmatic. This is a party that literally wants the middle class to pay more just so the working poor have less. And that's a weird cycle. So we see, Congress is about to make this worse. There's a lot of focus on that. But assuming we can protect the Affordable Care Act, I think this is really the first election in Virginia where these legislators are going to be held accountable for screwing over, if I may be blunt, their neighbors.
Okay.
And so we have a lot of legislators who talk nice but vote mean. They seem moderate when they show up at the Little League game, but in fact have been going to Richmond and pursuing a truly radical agenda that has hurt the middle class and the working poor here in Virginia. So I'm really excited to be here with Hala to have her talk about why she's going to change all that with this campaign in Richmond. So I'll hand it
Thank
to
you, Congressman. I'm Hala Ayala. I'm the 51st District House of Delegates candidate for the Democratic ticket. And I know firsthand the experiences with Medicaid. I know my current delegate, Rich Anderson, opposes Medicaid expansion. And that bothers me because I have a personal story with Medicaid. I was 24 years old, pregnant with my son, and I had some challenges, just carrying him. And I was uninsured, working at a gas station just down the street from my house off Old Bridge Road. I won't tell you which brand because I'm not going to plug anybody. But it was just very scary when you're in this situation because the coverages and the costs could be so excessive and it could be life-threatening. And some of my experiences prior to me giving birth to my son were just that, life-threatening. When my son was born, he was born with breathing complications, diabetes, several other issues. Later found out acid reflux. And they sound very common, but for children or newborns, they can be very life-threatening. And we were in and out of the hospital, and thank God he was covered under Medicaid. Otherwise, he may not be here today. Just because of the challenges, breathing challenges, respiratory challenges. Where I live in Prince William County, my story is not an isolated incident. Over 12,000 of our Prince William County constituents live there and do not have coverage. As Tom was sharing that, these can be grave situations and that, premium costs go higher if you're not covered, and also those who need it could be covered. They may have experiences just like mine or just pre-existing conditions or rely on the care that they already are receiving. If Medicaid is cut, we will be facing another humanitarian concern. I don't know if I should be so frank, so I'm thinking about this, how I want to frame this, but a Republican GOP-controlled legislature, it doesn't seem to have an interest or a vested interest in the constituents or the better opportunities and quality of life for our constituents in Virginia. And I say constituents, I should say our friends, our neighbors, our family members. For me, I want to change that because I look at Virginia as my family, and I want to do whatever it takes to protect them and be the buffer between those national policies that can impact those who may have had experiences like mine or maybe different experiences but rely on Medicaid for their day-to-day survival. The bottom line is we can't afford to cut these services to our friends and our family members and our neighbors. We are supposed to be a country with heart, and Virginia is for lovers, and I want to continue that sentiment as we go into November, and hopefully my fellow constituents or my neighbors and my community members will agree on November 7th.